Welcome back. If you recall from parts 1 and 2 of this series, the Institute of Medicine recommends that we must work in 5 environments to have an impact. Summit participants worked in 5 separate groups to consider the challenges associated with each of these environments and recommended some broad actions that could be taken. As a reminder, the environments included food and beverage environments, the Hillsborough Challenge. How do we create environments that ensure that healthy food and beverage options are the routine and easy choice? Physical activity challenge. How can we make physical activity an integral and routine part of life? Message environments or challenge. How can we transform messages about physical activity and nutrition? Healthcare and work environments. Challenge. Where can we expand the role of healthcare providers, insurers, and employers in obesity prevention? School environments. The challenge. What can we do to make schools a focal point for obesity prevention? Dr. Donna Peterson now facilitates the sharing of these action recommendations from the 5 separate groups of conference participants.
So I hear you all did good work in your groups. I hear you came up with lots of ideas. And then I heard you tried to be tricky and lump them all into 2 or 3. Right? That's an old trick. You can't fool us. So staff have been inputting abbreviated versions of your priorities so that we can get your input on them as we go forth. And you'll see as we go through each of the ideas, the action items that the groups came up with, you will be asked if you agree or disagree. And what we're trying to get at here is what are the most practical, meaningful, easy to implement ideas. So I suspect you may like them all, but it won't help us if you like them all. We need you to be a little more discriminating than that. So what I'm going to do is ask each of the group leaders and facilitators. You don't have to come up here. We'll just bring the microphone to you, but please don't start talking until you have a microphone in your hand. You can tell us a little bit about your group's deliberations and the top 2 to 3 ideas you came up with. So we're going to start with our marketing group, which was led by Dr. Ellen Wartella and facilitated by Mary Jane Harrington. Mary Jane, you are here. Mary Jane needs a microphone. I was ordered to not let you utter a word. Here comes one. She's right up here. So tell us what your group came up with first, and then we'll vote on each item, okay? Mary Jane, thanks.
Are you gonna, there we go. Okay, so we had a really wonderful active discussion group, and we had people from all different types of organizations there, and a lot of them were responsible for messaging for their organizations. So we had some great ideas, but we really did come up with a consensus on the top 2 thoughts that we had about getting things started here in the Tampa Bay area. The first one was to formulate a social marketing campaign that sends the message that we want to be one of the healthiest cities in America. And tied to that actually was another concept that we want to send the message that we're in this together. That there are various different types of communities all throughout Tampa Bay. We talked about Waimama, we talked about different areas, North Tampa, South Tampa, Town and Country, Odessa, West Chase, you name it. They're all very different communities, but we're all in this together, and we want to be the healthiest city, or one of the healthiest cities in America. We don't want to be off that list, as they talked about before. So we wanted that to be part of our social marketing campaign. So that was our first idea. The other idea that we had was that we wanted to basically start researching what other cities were doing where their social marketing campaigns were concerned. We wanted to see what other cities were successful at social marketing and getting the message across in a concise way and seeing results. So we thought, those were our 2 top ideas. So that's it.
Formulate a social marketing campaign that sends a message that we want to be the healthiest city in America. 86% of you agree that that would be a good thing to do. Okay? Excellent. Now the second one, research other cities who have seen success with social marketing campaigns. Okay, that was the other idea out of the marketing group. 86% of you agree with this one as well. You think it would be worth taking the time to study how other cities have done their social marketing campaigns. Food and beverage was led by Lori Wright, president of the Florida Dietetic Association, faculty member at USF, and the facilitator was Dewey Carruthers of Dewey and Associates.
One of our suggestions was a farm to convenience store program, making fruits and vegetables available at convenience stores, especially at convenience stores in food desert areas. And then the second one is offer nutrition education in schools again. And then our third one was strong parent education, including cooking demos and other resources from the Partners in Obesity Prevention Coalition.
60% agree with this, 40% don't agree with this. 79% agree, 21% disagree. 79% agree, 21% disagree. All right, let's jump to our schools group. That was led by Paulette Walker and Maureen Chiodini.
We were a little more, I think, a little harder on ourselves because we put some deadlines on ours. So our first, well, of course we did. Our first one is to communicate the school district wellness policy to everyone. Did y'all know there is actually a school district wellness policy, but it's actually about ready to go before a vote for the school board, and it's just been reworked. There was one years ago that came out of a group that got together of community advisors, and then it is now going before the school board. So once it is approved by the school board, it is to communicate it to all of the stakeholders, and then it will be an ongoing item on the School Health Advisory Council meetings, the SHAC meetings, and then we'll utilize the PTAs to help educate the community as the policy is implemented, and it will be incorporated into each school health improvement plan. So this policy will actually show up where all stakeholders can actually view it, see it, and then we even spoke about evaluating the schools based on how well they work with the whole entire plan. So well, that will happen as soon as the school district approves it. And then our second one is by the beginning of school starting of 2013, so August of 2013, we will have identified a list of resources for every elementary, middle, and high school to use for all children who have BMI testing done, who will get a letter from the district that states anything about their BMI, but along with that letter will be a resource that says, here's where you can go in your community to do something about whatever has been identified as your issue with your BMI, whether you're in the 85th or 95th percentile, or whether you're in the failing to thrive also. So that will be specific resources for specific schools, including what is available and who to contact and what the cost of that is.
First one is communicating school district wellness policies to everyone. 85% agree with that one. 15% disagree. And then identify community resources for every school. 83% agree. 17% disagree. Okay. High degree of enthusiasm for these ideas. Workplace and the healthcare group, that was led by Clara Cobb and facilitated by Linda Leedy. Linda, are you going to do the honors from One Bay Healthy Tampa?
All right, our first recommendation is to, let me back up. We had workplace and healthcare environments, so we had two different venues to come up with recommendations, which was challenging because we had the same amount of time you guys did. We had two places to work with. Our first recommendation relates to the healthcare providers, and it is increase awareness of BMI through providers, schools, and education. And we have some specific suggestions for the POP committee when they get to this, such as making BMI the fifth vital sign in the outpatient setting for physicians, having the Department of Health at the state level add BMI as a mandatory field on the blue and yellow form that kids submit when they go to school, increase incentives for providers to track and address BMI with their patients, have more increased, better provider education on obesity. We had a physician provider in the room who said that medical schools, even 10 years ago, were not educating on obesity. So get education in at that professional level training so they can have conversations with their patients. And then education awareness to senior centers about BMI. Our next two recommendations have to do with the workplace. The first is to promote business case for breastfeeding policy for breastfeeding mothers returning to the workplace. This is apparently a national policy or national campaign that already exists. It's on the ground in Hillsborough County already. It just needs some more resources and some more promotion to make it happen a little more effectively. And then our last recommendation is to develop a guide for workplace wellness policies and programs and promote wellness incentives for businesses, including implementing wellness policies, encouraging walking meetings, encourage fit-friendly workplaces, which is a recognition a company can receive through the American Heart Association, and then connect health and wellness vendors to this workplace guide for wellness policies.
So let's see the votes. 83% agree. Increasing awareness of BMI. 17% disagree. All right. The second recommendation out of this group was promoting breastfeeding policy for mothers returning to work. Let's see the vote. 88% agree with this. 13% disagree. The third recommendation out of this group was developing guides for worksite wellness. 94% agree with this. 6% don't agree. Boy, that got a gasp. It's like the Academy Awards. All right, excellent. That was a good group. And our last group, the physical activity group, led by Bill Purcell and facilitated by Raymond Cheramonte.
Okay, we have three. The first one was design roadways that include reduced speed limits, street lighting, continuous sidewalks, bike lanes, and bus pullout lanes where possible. Okay, second one is create better access and programming in multi-use spaces, combining schools, parks, public spaces, and programs such as Boys and Girls Clubs, YMCA, in a single accessible area with regularly programmed and advertised activities, basically using schools and parks working together in the community. And our third one is to educate citizens and elected officials on rules of the road, engage them in planning process, programs such as giving away vests to bicyclists and lights for bicycles, events and outreach.
New design of roadways. 83% agree. 17% disagree. Second idea, creating better access and programming in multi-use spaces, so using spaces that are available for multi-purpose use. 85% agree. 15% disagree. Okay, and the last recommendation of the physical activity group was to educate citizens and elected officials on rules of the road. 64% agree, 36 do not agree. Wow. You all obviously did a lot of good work this afternoon, came up with a lot of interesting ideas. I like how you took systems approaches to thinking about this stuff, ideas that were not the usual suspect ideas. I heard some very creative things come out of these groups. And so our leaders will now consider all of this and come up with a plan, right? Is that the goal? All right, well, I want to thank you all. You worked really, really hard, and I know Dr. Gordon has a few words.
Okay, thank you for hanging in there with us. It certainly demonstrates your commitment. I have one little blurb from a research study I want to share with you, and I promise you we won't be long, all right? All right, Terry? This is a blurb I saw the other day. People living at higher altitudes are slimmer, study says. And this was a study done on 400,000 people in the US. Researchers found Americans living closest to sea level, us, were 4 to 5 times more likely to be obese compared to the people who live well above sea level in Colorado. I have to admit to you that when I saw this first, my immediate reaction was, I have got to move, all right? I'm sure your initial reaction was a little bit more intelligent and cerebral. Maybe you started thinking about what's different in Colorado. Maybe you wondered, what's their economy like, their demographics? What about their built environment? Do they have lots of trails and opportunities for physical activity? What about their green infrastructure? Do they have more farmers markets? Do more people have access to produce and healthy foods? What about their school system or their transportation system? Do they have a health behavior culture that may be a little bit different from ours? And if yes, why? Well, these questions didn't come to me immediately. It was later that I thought about some of these things. And I just want to say it's the kind of thinking we wanted from this group today. We invited our partners and friends and stakeholders to think beyond the obvious knee-jerk of, let's just pack our bags and move to someplace higher, okay? We wanted you to think deeply and broadly, like Dr. Peterson mentioned, and creatively, and you did that. We wanted you to think globally as well, but think also about how it's going to be implemented locally. We wanted the combined expertise and experience of different people from different places doing different things. And we got that. I think we got that. We got some great ideas, some interesting thoughts, some creativity. So that was wonderful. You can probably tell by now that our model for how we think about obesity is that everyone has to be involved. The discussion this morning, the topics this afternoon should have made that quite clear. If that point was not made, then we did something wrong. But I don't think we did anything wrong. I think that point was well made. So we need everyone to be involved. So what do we do now? We certainly have to respect and honor your input and your work this afternoon and your time. And so what we're going to do is to move these broad action kind of statements to another group to do some work. The group that we're thinking of is the Partners on Obesity Prevention. And this is a group that has existed since 2008. And the membership involves anyone who really has an interest in wellness in Hillsborough County. But the focus truly is obesity. Their mission: promote treatment and prevention of obesity in Hillsborough County communities through advocacy, education, and resource sharing. So what we would like to do, rather than creating a whole new, another coalition, we want to ask this group to take these broad ideas and actions and think about more measurable sort of objectives and action plans and maybe processes, and think about who we can find as owners for any interventions that we may be implementing. So that's what the Partners on Obesity Prevention is going to be doing. This group used to be chaired and facilitated by Cindy Hardy. Many of you have spoken to Cindy, communicated with her. She has given up that role, and we now have Linda Lacombe-Williams, who will be leading the group and has been brave enough to take on the work that we're going to be doing with that group. Linda, if you'd stand up for the group, all right? Linda is no stranger to public health, and she is actually retired, do I dare say that? Retired from the Department of Health. In her retirement, she's faculty at University of Tampa and Springfield in their nursing program, and she's also a legal nurse consultant. This is what she does in her retirement, and she's going to take on this as well, all right? So the next meeting for POP, an unfortunate name for a really great group, all right, POP, is April the 3rd at the Children's Board, and you are all welcome to attend if you would like to do that. It's open to anyone who'd like to be there to talk about the issues related to obesity and chronic disease and the health of our community. And of course, they're going to be working on these items. So I'm sure Linda would be happy to share her contact information with you. You also have this little flyer in your packet so that you could go to the website if you'd like to. Feel free to call us at the health department if you'd like more information on POP or you'd like to be more involved. And if you permit me just one cliche, it takes a village. It takes a village to raise a child, and it takes a village to solve complex public health problems like obesity. And so my point is that we really need to have you stay engaged in this. You did a lot of work for us today. We'd like you to either participate in POP, or if you're asked in the future to be involved in some intervention, we'll hope you say yes. But we want you to be involved. It means we all have to be in order to solve this really phenomenal problem. If it was easy to maintain a healthy weight, Oprah would be slim, okay? She has the money and the resources to do it, and she hasn't, all right? It's just too complex a problem, and I'm not picking on Oprah for any of you Oprah fans out there. So stay involved, stay engaged. We look forward to working with you. I don't want to end the day without saying thanks to our sponsors, AmeriGroup, Nestle, Moffitt Cancer Society and the Center for Equal Health. We've also had a great planning group, and the names are all listed. They were introduced this morning, but you can see on your agenda today who they were. They did an excellent job. Thank you all. Our speakers and facilitators, we asked them to do a huge job here. I don't know if any of you have seen the full IOM report, but folks like Linda Leedy read the whole thing, right? And she did it when she should have been resting or relaxing. So we thank you all, the speakers and the facilitators, for the great work you did today. Thank you very much. Now, Dr. Donna Peterson was our facilitator for the day, or moderator for the day, and she did this when we ran into a little bit of a problem, and she quickly agreed to be here for the day and do this and commit her time, and did a wonderful job, don't you think? Thank you. Okay, and then last but not least, of course, the staff of the Hillsborough County Health Department. We had lots of folks here on our staff who did behind-the-scenes things. Without them, this day, believe me, would not have happened, no matter how much I might have wished it. Without their work, it would never have happened. So thank you all very much for your work as well. We must end this series by asking, is there something that you as an individual can do to achieve a healthy weight or prevent obesity? Most individuals already know that to achieve a healthy weight, we must eat healthy and commit to regular physical activity. I have joining me Barbara Roberts, registered dietitian and nutrition consultant for the Florida Department of Health in Hillsborough County. Barbara, can you share some specifics on how we can do something to reduce the problem for ourselves, for families, and for this community?
Yes, thank you for having me. Weight loss may be one of the hardest things you've ever done. Much research has shown that just losing 5 to 10% of your current weight can significantly improve your health, potentially by lowering blood pressure, glucose or blood sugar, lipids, which are fat in the blood, cholesterol and triglycerides, as well as improving stress in your joints, such as hips and knees. If you weigh 250 pounds, 5% of your current weight is 13 pounds, and losing just that could improve your health. To lose weight, you must eat less and exercise more. Of course, we all know it's not that easy. Today's world is fairly sedentary, and high-calorie foods that smell and taste good are everywhere we go.
I think you're right, Barbara, and it doesn't help that we have really tasty-looking foods at very low prices being advertised. A bacon cheeseburger for $1 really doesn't help us. So what are some specific things we can do?
Try not to eat when you're not hungry. This may sound simple, but how many of us eat candy off a coworker's desk when we're bored, stressed, or we eat samples at the grocery store even though we're not hungry? Remember HALT, an acronym for hungry, angry, lonely, or tired. These emotions can lead us to eat too much or just eat more of the things we shouldn't be eating. Remember HALT. Here are some ideas to help you lose some weight. Eat regularly, at least every 6 hours while you're awake. If you wait too long between meals, you may end up eating too much at the next meal because you're so hungry. Remember, it's okay to spoil your dinner as long as you do it with healthy snacks. Eat more fruits and vegetables. Optimally whole fruits and vegetables, and limit the starchy ones such as potatoes, corn, or peas, plus limit the juices. You want to get more fiber from whole fruits and vegetables to keep you filled up. Choose whole grains, whole wheat breads, brown or wild rice, high fiber cereals, popcorn, whole wheat pasta. Aim for 1/2 to 1 cup of these at a time. Measure your foods after cooking. Avoid or limit the calorie-containing beverages. Drink water, diet drinks, or the lower calorie drinks. Water is best because it will promote satiety, which means keep you full. Remember, all the sugar substitutes are safe. Use lower fat, lower sugar versions of your favorite foods. It may be only 10 calories difference, but 20 calories a day for 6 months is 2 pounds. Try the low-fat mayo or dressing and low-fat or fat-free milk. Some of us have become overweight over the past decade, which may have been just 1 or 2 pounds per year, but after 10 years, that can be 10 to 20 pounds. Watch portions and measure. Buy measuring cups and use them often, at least once a month. The right amounts are usually 1/2 to 1 cup, but unlimited amounts of fruits and vegetables, not the starchy ones or the juices, however. Use heat-safe measuring cups instead of serving utensils when plating your foods to help you become more aware of portions. In addition, use smaller dishes, smaller glasses, plates, and bowls. Use the antique china, which likely serves the portion sizes we should be eating. To find out how many calories you should be eating or how many to lose weight, go to the myplate.gov website. Limit eating out as much as you can. Restaurants add hidden fats to make things taste better than they do when you cook them yourself at home. Plus, the portions are often huge. Many restaurants have the nutrition facts on their menu or on their website for their menu items. Plan ahead and go to their website to educate yourself about their menu, trying to limit calories, fat, and sodium as much as you can. Or if you're at a restaurant and not sure what to order, select the grilled, baked, and broiled items and choose the steamed vegetables and whole grains, always being keenly aware of the large portions. When you are ordering the meal, make sure to ask the waitstaff to bring a to-go box with your meal. Once your meal arrives immediately, put at least half in the to-go box. Restaurant portions are usually enough for 2 and sometimes enough for 3 or more people per entree. Another option could be to order an appetizer as your meal, careful of the fried foods. Always request dressing and sauces on the side. Request less oil and butter used on your entree, which is used even on the grilled options sometimes. Ask for lower calorie dressings, cheeses, and sour cream. If you have children that eat out with you, select the fruit or vegetable with their meal too. Many restaurants are doing more of this by offering something besides fries with the kids' meals. When eating at other events, such as sporting events, bowling alleys, or movie theaters, try to choose a fruit or vegetable option, which are sometimes available. Or when you can, and it's possible to do so, save money and pack your own fruits and vegetables, which will help save you calories too.
I do like your points about eating out, because while we do eat out for convenience, we also eat out for fun. So we don't want to feel deprived when we're eating out. So your points about possibly taking some home, taking home a doggy bag, in other words, and the information you shared about how to reduce calories through lessening the fat and sugar are all good points. But we also know that what we consume is only part of the equation. We have to be physically active. And for some of us who are very busy, that becomes a challenge. Mm-hmm. So what are some points that you can make about physical activity?
Yes. Well, try to just move more. Many of us were active as kids and may remember being told not to run or slow down. Take a second and try to remember what you did when you were a kid to be active. It wasn't a chore then, it was play. Try to do some of that again today. Remember, start slow and go slow. Don't overdo it or you may have pain the next day. Or just move more any way you can. Move your trash can across the room at work, move your printer across the room, or get a communal printer that is several feet away you have to use. Every time the phone rings at work, stand up. You burn a few more calories standing than sitting, walking than standing still. Move. Just do something that requires movement more often. Try to get active with a friend or family member. If you have someone do it with you, then it may help keep you committed. Chatting with a friend while moving, walking, and biking helps the time pass faster too. National guidelines for physical activity recommend 30 minutes most days. But the important thing is to get moving and to do something. If you can't do 30 minutes, just do what you can and work toward 30 minutes.
Okay, great. Well, Barbara, could you talk a little bit about what resources the health department may have to offer to help, in terms of reducing obesity?
Yes, I'd love to. Our gift program for Get Into Fitness Today, we've had in Hillsborough County since 2007. GIFT is a support group-like weight loss program and is led by community health workers. Plus, it's free. GIFT encourages regular physical activity and improved nutrition through weekly topics such as portion control, meal planning and shopping, physical activity, and chronic disease prevention. GIFT materials are available to anyone or any group who wants to lead a weight loss group. GIFT groups are hosted by churches, community centers, and sometimes just a group of 5 friends who get together once a week anyway. Instead of dinner and drinks, try GIFT. You meet once a week, do some exercise, offer support and encouragement to each other, and as a result, lose weight. Some people call, and they may have heard of GIFT, but then there's not a group near them. We need people and businesses willing to take our free materials and host a GIFT group. If you can get a group of 5 people together once a week for 6 to 12 weeks, you can do GIFT and support one another in weight loss. GIFT is successful because the participants are accountable and supportive to each other, and they learn the real tips to help lose weight and improve their health, not the crazy stuff. GIFT has been done at work sites as part of an employee wellness weight loss program. It's free for work sites too. We've learned from people hosting GIFT groups at work that the work participants were more successful with losing weight. They supported each other all week, not just at the weekly meeting, and then exercised together on breaks, and some even changed the corporate culture to become a much healthier work site. Many of us spend more time at work than with our family, and if we can get healthier in the process, there's an added bonus. Work sites doing wellness programs have seen a return on investment of anywhere from $1.50 to up to $5 per dollar invested in worksite wellness. If you're an employer, the benefits you can get from offering a wellness program, especially one like GIFT that's free, are healthier and happier employees, more productive and less presenteeism from your employees. Presenteeism means you're at work but you feel sick, maybe from high blood pressure, high blood sugar, and your mind is somewhere else, and as a result, your work performance suffers. You can also get lower healthcare costs as a result of employees being healthier, more loyalty to the workplace, and less turnover because the employees feel the workplace cares about them, less sick time taken by employees, and numerous other benefits.
Thank you, Barbara. There were some next steps that follow the summit. A community coalition, the Partners in Obesity Prevention, was tasked with creating action plans. They will be working on the specific steps that could be taken to address the challenges in the 5 areas. You can also contribute to these efforts by participating in the partnership, partnersinoBesityPrevention.com. For more information on the Institute of Medicine's report, you may go to their website, iom.edu. To participate in the GIFT program, go to getintofitnesstoday.net. For other health department programs, go to hillscountyhealth.org. I hope you enjoyed this program. Thank you for joining us.